Okay, so you've just sat down in the dental chair, the assistant has put your bib on, and you're waiting for the dentist to come in. How many of you have any idea what your dentist is about to do? Stick around and I'll do my best to help. Well, hello again, folks, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the U.S. So the main reason I decided to start this YouTube channel was because I felt that way too many patients, probably even mine, had no idea what their dentist was doing. Did they understand the need for this visit? Was it explained to them what was going to happen in simple, easy to understand terms? And did they know what to expect afterwards? Far too often, the answer to that question was no. In today's video, I want to go over several things that I hope your dental office is doing to help answer all of these questions. And to do that, I want to refer to the comments and suggestions that one of our dental gurus, Dr. Gordon Christensen, said on this very subject. Now, I've had the pleasure to meet and hear Dr. Christensen lecture on a variety of subjects on dentistry, and for those of us in the profession, when Dr. Christensen talks, we listen. So to start out, how have you felt when either you or a relative were about to undergo a medical procedure, but were not informed about what to expect, be it potential outcomes or healing time, any complications that could arise, or whether there were other treatment alternatives to consider? Chances are you might start having doubts about whether you made the right decision to proceed, and would at least have some form of anxiety and fear. Compare that with having the entire procedure explained to you by your doctor, having them tell you that they've done this procedure many times and are very skilled at it. Would you not have more confidence that everything would go well? Of course you would. So how should a dental office accomplish these challenges? Far and away, one of the best methods is to have a very well-trained and knowledgeable staff. Why is this the case? Because no matter how nice and calming and personable we doctors try to be, as soon as we enter the room, it's like, the patient is on high alert. Now things are about to get real, am I right? Whereas if your dental assistant or dental hygienist, who are not threatening at all, can explain everything that you need to know before I even get into the room, the chances are you, the patient, are going to be more confident and at ease. Now, of course, you might be like my wife, who really would prefer not to know anything, just tell her when it's over, but for the vast majority of patients, this is a great first step. So now that we've determined that the staff is the true gateway to educating the patient, how else can a well-run dental office utilize these team members? Well, during a patient's first visit, after diagnosing treatment needs and patient desires, your dentist will typically offer an introduction to the procedure they plan to accomplish for you. And to do that properly, we need to gather diagnostic data. And here comes the staff again to take x-rays, models, photos, charting, and blood pressure, just to name a few. They can explain why they are gathering this information and what will be done with it. Typically, for a patient with simple problems, the doctor is only involved for a brief introduction at the beginning of the appointment and at the end to discuss the treatment plan. Are we sensing a trend yet? The patient education also needs to continue at each subsequent appointment, not to pester you, but to reinforce what you have already been told. So what exactly should patient education encompass? Well, you need to know and understand a relatively detailed explanation about the suggested procedure and expected outcome, that you understand the procedure and can acknowledge this understanding when questioned by the staff, that you have enough information to decide whether or not to undergo the procedure, and that you agree to have the procedure accomplished. Next up is informed consent. Now, dental informed consent has the following components. It includes going over the treatment alternatives, their advantages, disadvantages, cost, and risks, and what happens if treatment is not done. I know from experience that patients will often rely on the advice of the staff as to whether to move forward with treatment because they view the staff as easier to talk to than the doctor. Again, an educated patient is a confident patient. And finally, patient education needs to continue even as the treatment progresses. When you know what your dentist is doing as the treatment is actually being provided, you're going to be much less apprehensive about what is happening to you. You also need to know what to expect after treatment and when you get home. One thing that would be very helpful would be that you go home with written information regarding what was done that day, any follow-up treatment needed, and possible complications you might experience. Because let's face it, you're not going to remember everything you were told. Am I right? Well, if you haven't figured it out yet, folks, education is the key for a successful treatment. An educated patient can help avoid many misunderstandings, and that education needs to be delivered in simple terms by trusted individuals as often as needed to ensure complete comprehension. I hope you gave your dental office high marks on today's topics. Well, let's wrap up today's video, folks. I hope you learned something that you didn't know before. If you enjoyed this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Feel free to leave a comment or question as well. Please consider subscribing and be sure to hit that bell icon so you can be notified of future videos on Dentistry Made Simple. Bye-bye.